Okay, so Shifa, so we will start within 1 minute. Thank you.
Is Dr. Vidya already with us now, Reza?
Yes, he's here.
Oh, okay. How are you, Dr. Vidya?
Fine, thank you. How are you, Prof? I kept on calling him Prof. It's just a matter of time.
You look fresh.
Thank you.
Okay, good morning. Okay, we will start our today's webinar. Good morning, all distinguished speakers, ladies and gentlemen. I'm Shifa, as your master of ceremony of today's webinar. First of all, allow us to extend our warmest welcome and greetings to all the lecturers, honorable guests, and all participants to join today's webinar, COVID-19 in Indonesia, a momentum to improve Indonesian social security system. The aim of today's webinar is to present, discuss, and also provide a platform for Indonesian policymakers, scholars, and other stakeholders to exchange views and share experiences on a particular topic of choice. This webinar is a collaborative work between VOP, between Faculty of Administrative Science, Universitas Indonesia, and University of Melbourne. Okay, as an overview of our today's agenda, first, we will start by watching a short promotional video on double master degree program on public policy and management, co-organized by Faculty of Administrative Science and University of Melbourne. Afterward, we will hear the welcoming speech from the representative of Faculty of Administrative Science and also from University of Melbourne. Next, our main agenda, we will be moderated by Mrs. Krishna Puji Rahmayanti MPA, along with two distinguished speakers, Prof. John Murphy, and also Dr. Vidya from Habibie Institute for Public Policy and Governance for around 20 minutes for each session. And then will be followed by Q&A session for the last 30 minutes. Before we start, I would like to inform you that the presentation material will be distributed via email for the registered participants. For those who are watching this webinar via YouTube, you can download it from via VOE official website. And the certificate of attendance will be provided only for registered participants after fulfilling a brief survey by the end of this webinar. Okay, moving to the next agenda. We are now going to take a look at the promotional video on double master degree program on public policy and management, organized by Faculty of Administrative Science and University of Melbourne. Okay, we're really sorry for the inconvenience about the audible audio. Okay, for those of you who are interested to get further information about this program, you can contact us via email on iovia@ui.ac.id, or you also can visit our official website on via.ui.ac.id/en/double degree. Moving to our next agenda to open today's webinar, I would like to call upon the head of Public Administration Department of Faculty of Administrative Science, Universitas Indonesia, Dr. Roy Valian Salomo. Please welcome.
Thank you, Siva. Well, good afternoon, Professor John Murphy and Dr. Scott Branton. And also good morning to Dr. Vidya, our speakers. Honorable guest, Dr. Scott, the Director of Master of Public Policy and Management, University of Melbourne, and colleagues and participants, on behalf of the faculty, I would like to welcome you all to this webinar with a very interesting topic on COVID-19 in Indonesia, a momentum to improve Indonesian social security system. Despite its devastating impact, this pandemic may have done more than anything else in the world to hardly push a number of innovative ideas that may not be happening without the pandemic stimulus. In academic sector, for instance, according to UNESCO, school closures have affected more than 60% of the world's student population, or equal to 1.2 billion children from 186 countries. As an alternative, adoption of education technology and distance learning have been extensively used through online platforms, just exactly like this webinar. The COVID-19 pandemic has created a momentum for continuous improvement. The two main questions are perhaps what kind of innovation or changes are most needed, and how can we convince decision makers and public to push harder for a better tomorrow? Our today's topic may to some extent address these questions. The collaboration between VIA, University of Indonesia, and University of Melbourne have been rooting for years, aiming at strengthening the nation's human resources to tackle various wicked challenges and problems faced by today's modern society. University of Melbourne has been one of our great partners on academic and research collaboration. A 2-year double degree program in public policy and management is just one of them. This program provides students with an extraordinary opportunity to gain invaluable international experience while remain locally rooted. I hope you all have an excellent and insightful webinar session. Thank you.
Thank you, Pak Roy, for the speech. Next, please welcome Director of MPPM Program of University of Melbourne, Dr. Scott Branton, to say a few words. Dr. Scott, the floor is yours.
Thank you for the very warm welcome. I'd like to begin by acknowledging the traditional owners of the land upon which I'm based, so the lands of the Wurundjeri and the Boonwurrung of the Kulin Nation, and pay my respects to the elders past and present. I'm really pleased to be able to be part of this and to begin our formal launches of this dual degree. I think what's very exciting about this is it is a genuine sort of two-way exchange. We've been able to welcome many academics from UE to Melbourne, and I'm also looking forward to travelling to Jakarta next year in order to lead our first jointly offered subject in executive leadership and management. The university itself has had a long history of collaboration with Indonesia. The university's welcomed students from Indonesia since the 1950s, and now it's our third largest international student cohort. Within our degree, we've actually had a very large and very active student body coming from Indonesia. So this is really the logical next step. Recently, the university launched Engaging with Indonesia strategy for the next 4 years. And I was really pleased that one of the 4 priorities included policy design and governance. So there are really going to be lots of opportunities for joint research projects and joint exchanges. And I'm very much looking forward to welcoming the first cohort in this joint degree, which I think is innovative. It's really going to separate out graduates to be able to get 2 degrees from 2 leading universities. Is going to be very valuable and very attractive to employers. So thank you again for welcoming me, and I'm really looking forward to learning more about what's going on in Indonesia at the moment. Please do stay safe and do get tested if you can. And hopefully we'll be past this by the time we come over to Indonesia next year. Thank you.
Okay, thank you for your humble speech, Dr. Scott. Okay, ladies and gentlemen, we are now going to the main session. But beforehand, I would like to introduce our moderator for this session. Please welcome Mrs. Krishna Puji Rahmayanti, MPA. She is a lecturer and also researcher from the Department of Public Administration. So, Mrs. Krishna, time is yours.
Thank you. Good morning, everyone. Prof. Murphy, Pak Roy, Dr. Scott, and everyone. Bu Widya. And also welcome to all the participants. There are already 43 participants via Zoom, and we also have many participants via our YouTube channel. And welcome everyone to our webinar today. My name is Krishna, and it is an honor for me to moderate the discussion today entitled COVID-19 in Indonesia, a momentum to improve Indonesian social security system. This discussion is part of a promotional session of our double degree program, Master of Public Policy and Management between Faculty of Administrative Science, Universitas Indonesia, and also Faculty of Art, the University of Melbourne. And today's discussion is very relevant not only for the academician, but we hope it can also improve the discussion among the policymakers, students, international community, and also Indonesian society. Today's discussion is also part of our faculty commitment to solve the current issue and bridging the gap between the theories and also the practice. Since the first confirmation of COVID-19 case in Indonesia on March 2nd, 2020, the number of COVID-19 patients has multiplied rapidly. The infection reached all the 34 provinces in Indonesia, and the latest update yesterday, the number reached 93,000 confirmed case, with more than 36,000 hospitalized cases, and with 53,000 recovered cases. And the death rate is around 4.9%, or the number is 4,576. So hopefully the discussion today can help us to discuss about how is the strength and weakness of our current social security system, the historical overview of our health security, and the most importantly about how we can cope with the COVID-19 impact with the social security readiness. So we have a good opportunity today to discuss with 2 prominent speakers. Professor John Murphy from the University of Melbourne. Welcome, Prof.
Thank you.
And also Ibu Widya, Dr. Widya Laksmanawati Habibi Professor John Murphy teach and teach Australian politics and history and comparative social policy history with a developing focus on Indonesian social protection. His most recent publication in 2019 is about Indonesia, the historical development of Indonesian social security. And Ibu Widya, Dr. Widya Laksmanawati Habibi, is Executive Director of Habibi Institute for Public Policy and Governance, Faculty of Administrative Science, Universitas Indonesia. She is also a lecturer at the postgraduate program, and interestingly, she has very unique background as a dentist by training. So we have two prominent speakers today, and hopefully we have virtual discussion. We'll have like 20 minutes for each speaker, and in the end, we will have 30 minutes for question and answer. So for all the participants, if you have any question and statement, please write down at the question and answer section below. Or for those of you join from YouTube, you can write down at the comment section. I will read at the discussion session. Okay, so we will invite our first speaker, Professor John Murphy. Please, the time is yours, Prof.
Terima kasih, Krishna. Let me go straight to my desktop. So is that showing? You can see that?
Yes, perfect.
So thank you very much for inviting me to participate in this webinar, and thank you once again to UI for both this, but also for the important partnership that we share together. What I want to do today very briefly is talk about this pandemic, not in terms of health policy and health access to health care, but more as a public policy challenge and as an economic challenge, if you like. We can think of a crisis like this as a lightning flash. When we're outside at night, we have a sudden flash of lightning, we see the landscape anew. And there are ways in which we can look at how this crisis, this pandemic, is illuminating our societies. So for example, in Australia, it's illuminated the quite large number of what we would call informal sector workers in Australia, who have very insecure work through the gig economy, delivering food and so forth. And this crisis has made that clearer, what the numbers are in that sector of the economy, which we have not appreciated properly. So I want to talk about four things quickly. First is the wicked problem between state and government and citizens that this crisis throws up, the ways in which public policy capacity and citizens' compliance presents quite interesting and difficult challenges. The second is very briefly to talk about what the existing safety nets are in the four countries that I want to talk about, the existing safety nets to deal with the economic consequences of the pandemic. Third, I want to just briefly talk about the particular problems of the informal labour market and of migrant workers and the ways in which they might be, in both cases, being left out of the policy initiatives that are to deal with the economic impact of the crisis. And finally, I want to just talk briefly about what initiatives have been tried in Indonesia, in Malaysia, in the Philippines, and in Thailand. So they're the four case study countries that I want to look at very briefly. Okay, so this is an index that the Asian Development Bank has developed in consultation with University of Oxford, which is trying to measure the stringency, the hardness, if you like, of lockdown suppression responses in different countries. And if you can see to the left here, to the right here, this is Indonesia's response. So darker colour means harder, lockdown, so relatively light colours in the Indonesia case. Also relatively light in Malaysia, which is surprising. Stringent lockdown in the Philippines, and fairly significant action in Thailand. So this is only up until the end of May. By the end of May, quite a lot of people were thinking the crisis is past, and it clearly isn't. And we're clearly back into the second wave. So this kind of attempt to examine how rigorous, how hard lockdowns have been is interesting, but only an approximate picture of what's been happening. This also relates to the question of compliance and the relationship between states and their citizens. These are the rules that have been made rather than the behaviour that has been consequential on that. Governments can declare that this is the rules, this is the law, but if no one takes any notice, then their policy response is somewhat meaningless. So that's one part of the trade-off between a health lockdown, an economic lockdown, and the economic contraction that's a consequence of that. Next slide is some projections of the likely or expected economic shock of the coronavirus lockdowns. So on the left is what the Asian Development Bank has published in June this year, and on the right is what the World Bank has published in June this year. Obviously, these are guesses, right? They're not you know, exact predictions of the future, but they're a good example of the wicked problem that the coronavirus presents. How much attempts to lock down a society, to change behaviour, have an economic impact, and then the ways in which that economic impact has further profound implications for people. It's worth noticing that Thailand, on the left-hand side of this slide, Thailand was already in trouble this year with an expected contraction of the economy, now a greater contraction of the economy. In the left-hand panel, the Asian Development Bank was projecting that Indonesia would grow and is now projecting that Indonesia will contract by 1% of gross domestic product. So these are all growth rates as percentage of gross domestic product, the measure of the total size of the economy. The World Bank's estimates, Indonesia will just stop, not grow, but not decline either. So again, as I said before, these are guesses. They're not science. They're not an accurate prediction of the future. They're expectations, and they will in turn be affected by other factors. What happens as the pandemic plays out, what the death rates are, what other economic impacts might be consequent on future lockdown measures. So the second theme that I want to talk about is this relationship between states and citizens. And we can think of this as a triangle, but as also a movement round and round and round, a feedback effect between government policy, functional administrative capacity of the state, and thirdly, of citizens' compliance and discipline. This is quite a wicked problem that has been confronted in all societies as a result of this pandemic. At the top of the screen, government policy capacity. How much knowledge does a government actually have? How accurate are the health statistics that governments can compile? To what extent can any government actually know clearly what the the impact of the pandemic is, what the numbers are. To what extent is government policy capacity led by expertise or not by expertise? And then decisions to be made about suppression strategies that come at an economic cost, potentially about compensation in spending packages, and in many countries, including both Indonesia and Malaysia, that's then complicated by subnational governments, by provincial level governments, which may be acting in other ways. Down the bottom on the left-hand side are some considerations, not so much about policy making, but policy implementation. To what extent does a government have the capacity to enforce its decisions? To what extent can the decisions made about a lockdown, for example, of public transport be actually implemented? Can you bribe a policeman to get through a roadblock, as was happening in Indonesia's attempt at a lockdown at the end of Ramadan? On the right-hand side down the bottom, citizens' compliance and discipline, some very difficult questions about the extent to which citizens are willing to comply. We've had examples in Australia where people have simply said, well, we're supposed to be locked down, but I have organised a party and I'm going ahead with the party. So the capacity that the citizens have, A, to understand this problem, and B, their willingness to comply with new rules. And in the 4 countries where I'm talking about today, Indonesia, Malaysia, the Philippines, and Thailand, to different degrees, there is simply the question of poverty. There is simply the question of that it's not possible for people to simply stay at home and not work. If you don't work, you can't feed your children. So this is a feedback loop. It goes round and round. Government capacity to make decisions, administrative capacity to actually implement decisions, and citizens' willingness or not to comply. The next theme I want to talk about is to get a bit of a sense of the existing social protection safety nets before coronavirus. And this chart is based on data from the Asian Development Bank, their Social Protection Index, which shows the expenditure on social protection in these 4 countries. And Malaysia is the most developed by a long way, particularly using the insurance model through their Employees Provident Fund, where all workers, that is all formal sector workers, are actually obliged to save for future needs, both health needs and for pensions in retirement. Thailand has developed a quite extensive system of social protection, both social insurance, the blue and the red sections, but also Thailand's developed a significant social pension for the elderly since that's been in place since 1993. And Thailand also has quite big spending on child welfare. Philippines is more like Indonesia, with a lesser level of development, some pension and health insurance saving, some cash transfers. The red section would be, in the Philippines, would be largely their quite substantial conditional cash transfer scheme, plus a small social pension. Social pension being means tested for the poor without any saving, paid for from taxation. Indonesia on this scale is the least developed in its social protection system. The pension saving is very largely only civil servants. Health insurance, the green bit would have expanded significantly since BPJS Kesehatan, because this is in 2015, this graph. And Indonesia, especially under SBY, developed quite extensive cash transfer and child welfare programs. So why I wanted to show this is to indicate both the extent to which ordinary people, and particularly the poor, have some measure of a safety net prior to coronavirus, but it also indicates what existing mechanisms or conduits, if you like, are available for new measures, new initiatives to deal with the economic impact of the coronavirus crisis. The next section is just very briefly to mention these two particular challenges for policy, that Indonesia and Thailand have substantial informal labour markets, and an informal labour market where workers are in very insecure work, sometimes no employer at all, but sometimes an employer who has a small enterprise and doesn't want to be noticed by the state, doesn't want to be paying taxation. So in Indonesia, there are quite a lot of people who are employed in the informal sector by employers who prefer to be informal. Informal sector workers, by their nature, are very hard to reach with the kinds of measures that have been developed elsewhere to deal with the economic impact of coronavirus. And then finally, there's also the question of migrant workers. I'm not thinking here of internal migrant labour migration, but international labour migration out from the Philippines, and has been for a long time. 10% of GDP is huge in the Philippines, much less in the other three countries. And the other way around in Malaysia, Malaysia imports workers. Malaysia imports migrant workers. And it's become clear that some of them have been left quite vulnerable and neglected in Malaysia, and that many of the Philippines workers, especially in countries of the Middle East, are also neglected in state responses to the coronavirus crisis. Finally, two slides which give a bit of a suggestion. This is very early research yet, but in each of these four countries, there have been some measures taken, some of them quite significant. In Indonesia, there were cash transfers through the existing Family Hope program Keluarga Harapan, plus increased health spending, plus increased spending through the village funds. Malaysia developed a wage subsidy system, which I still don't know enough about, but which must have largely been for the formal sector workforce. The Philippines has been relatively slow and a relatively smaller commitment, but partly in the form of cash transfers, partly in the form of employment projects. And Thailand has had significant measures of cash transfers plus employment projects. So the final point that I want to make about these initiatives is the ways in which they're necessarily and understandably locked in to using existing channels. So what we saw earlier about what existed as social protection before coronavirus is also an indicator of what sorts of channels are available for stimulus programs to deal with the economic consequences of the pandemic. Indonesia used its existing Family Hope program, and that was not new money. It was really just bringing forward funds that had already been committed. It also used the existing Village Fund program, which, because it's a village development program, may be extremely slow in terms of actually having any impact. the Philippines used its existing conditional cash transfer program, but I have seen nothing about what is happening in the Philippines about its significant international labour outgoing labour migration and what's happening to those people as both in terms of their health, but also in terms of their income. Thailand has apparently spent significantly directing money to informal sector workers and those outside the social security system, but I don't yet know how they did that. And Malaysia has had the most advanced, I think, program in this sort of area of wage subsidies. And the existing Employees Provident Fund would have been one potential mechanism for distribution, or employers, the tax system, companies paying income tax. But Malaysia also has a large incoming migrant labour force, which is an underclass and which has been neglected in this area. And finally, I just want to raise the question about subsidised food programs. Both Thailand and Indonesia have had significant subsidised food programs, distribution of rice in particular. And to my knowledge, that has not been mobilised as part of the response to the economic consequences of the pandemic. And that is me. Thank you for your attention.
Thank you, Prof. Murphy. Ladies and gentlemen, we already heard the presentation from Prof. Murphy that discuss about the dimension about government policies, state functional and citizen compliance, and also comparative policy from Malaysia, Philippines, Thailand, and also Indonesia before pandemics and also in response of COVID-19 pandemics. And we will have the second speaker, Ibu Widya. The time is yours, Ibu.
Okay. Thank you, Mbak Krishna. Good morning, ladies and gentlemen. Good morning, Prof. John. Maybe I would like to share my screen. Can you see? Okay. So, can you see the screen? Oh, not yet. Sorry. Okay.
Share screen.
Yes, yes, yes.
Yes. Good.
Yeah.
Okay.
Wait. Okay. So I'd like to begin with the Indonesian National Social Security System during pandemic collaborative governance in practice. I think this is the different screen. Wait. Okay. This is my outline. And first, I would like to say about the history of National Social Security in Indonesia. As we all know that on 2004, we have the National Social Security System Law, which is number 14, 2004. And this is the basis of all the social security in Indonesia. It says that on 2011, they have also amended the National Social Security Agency Law, number 24, 2015. In 2011, that's BPJS. It says that on 2014, 1st January, the National Social Security Health Agency, which is BPJS Kesehatan, is directly going through, and it is a transformation from ASKES, Asuransi Kesehatan, which we had already before, only for the military and some civil worker. And in 2015 is the first that we do the National Security for Workers, which is BPJS Ketenagakerjaan. The objective of national health insurance is to enable people accessing healthcare services without financial hardship, and to perform cost-contained and quality-controlled healthcare services, to strengthen healthcare services at primary and referral health facilities, and also to prioritize preventive and promotive measures in rendering healthcare services to reduce prevalence of diseases over the number of sick people with efficient healthcare services. The factual problem of our health insurance in Indonesia is the availability and equitable distribution of health services in outer island to serve BPJS Kesehatan members and overall quality of healthcare services. It's also, there's the provider payment, which is issues with long time lapse for government primary care facilities in receiving capitation payment due to regulation on decentralization. And the lack of JKN, which is Jaminan Kesehatan Nasional, or the health insurance socialization activities for the people at the large, and coverage issues of people in the informal sectors, and assurance of sustainable financing towards universal health coverage and the contribution. I have to stop share, hold on. Okay. Now, can you see the slide now?
No.
No, okay. Excuse me.
Do you want me to help to share
yeah,
it?
I can, it's just.
Okay.
Yeah.
Yeah. Okay.
So. Okay, this is the factual condition that we have in our national social security system. The membership itself, until now, we have 82.69% of all Indonesian citizens, which is about 222 million people. And these are the first base of a clinic that we have. In total, which is 22,952. And the hospital itself, which is the referral, we have now is 62.77% is hospital owned by a private hospital. And in here you can see there's 8% is from the armed forces, because ASCAS used to be from the armed forces. So this is like the first where it is. And 29% is government hospital, and we have the pharmacies. So as we all know how we do the national social security during COVID-19 pandemic. First, I would like to highlight the cases in Indonesia. As you can see here, this is the latest. The red big dot is where we have lots of cases, and this is the mortality rate. It was up in July 10, but then it goes down now. It is because one of the school that have a COVID-19 and it spread it all of the kids. And the national social security during the pandemic, we see that the government took a quick action in response to the pandemic through PERPU, Government Regulation in lieu of Law, number 1 of 2020 on the handling of the COVID-19 pandemic. And the government also made the total budget, additional budget of 405 trillion rupiah, with details from 75 trillion rupiah for the health sector, 110 trillion for the social safety net, and 70.1 trillion for tax incentive and CUR, which is People's Business Loans Stimulus. And the 550 trillion rupiah is allocated to finance the National Economic Recovery Program. And there is a decreasing number of BPJS Kesehatan participants from January to April 2020. So you see here that the president is trying to cope with how to solve the pandemic by changing a hotel into a hospital, a hotel for hotel athlete. And as you can see here, as we see, there is some money that goes directly from the government to the people who got COVID-19. This is in Indonesian. I'm sorry, I read it in English. This is where, because there is like a act saying that it is a pandemic, so the government put it in here. This is like special forces how to do it. It's for the people. Even though they're with a COVID-19, but even though they are not membership of the BPJS, also they are the government will pay for everything for the people who got COVID-19. And even he's doing collaborative governance. On June 18, he was furious that all his ministers doesn't have sense of crisis during pandemic. So he really wants to have a shared vision to the ministers so that they can be more agile in dealing with the pandemic COVID-19. So the collaborative governance to improve quality of social security in Indonesia. What I see here, the we need to do like national social security reform. In policy level, we need to do revision for the National Social Security System Law number 14 of 2004, and the revision of National Social Security Agency Law also, number 24 of 2011, because even the chairman of the DJSN said that several articles of the National Social Security System Law and the National Social Security Act law were declared contrary to the 1945 Constitution of the Constitutional Court. So we really have to revise these two laws. And in the organization level itself, which is the BPJS itself, we have to reorganize the National Health Security Agency, accountability, and the span of control for 34 provinces. Because the span of control for the BPJS Kesehatan, usually they use it from ASKES. So it should be in the law, it says that every province should have an office of BPJS. But at the moment, even though since it was launched in 2014 until now, they don't have all in each provinces their office. And also their accountability have to be more. We have to make it stronger. And in operational level, we have to update the number of members who are in poverty, because there are some that says it goes with the PBI where the government do pay for them. And we also have to update the latest social safety net data, because the government gives some like social assistance, we call it bansos, to the needy people, which is quite a lot. And sometimes the data is not up to date. So at that time, before those people were in poverty, but not anymore right now, but they still get that bansos. So the collaborative governance to improve quality of social security in Indonesia, instead of I've told you about revise the law, and we also have to do the BPJS bureaucratic reform itself on the company, and also we have to do the institutional governance between actors, which is this is the BPJS, the BPJS with the Ministry of Health and the local government. We also have to reposition DJSN, which is Dewan Jaminan Sosial Nasional, or National Social Security Council. And also there should be the data integration between the Ministry of Home Affairs and Ministry of Social Affairs. This has to do also with the people in poverty, and also the standard norms, procedures, and criteria for hospitals, and the contribution and class arrangement of the member of the BPJS itself, and also information system for financial management to avoid fraud. So that's why we need a big data, a comprehensive data analysis that can support evidence-based policy making. as we see the 5V of big data, which is volume, velocity, variety, veracity, value, are the 5 keys to make big data a huge business. This is one of an example. The number of BBJS membership, which is both PBI, the recipient of contribution assistance, and the non-PBI. In the first term in 2020, it's fluctuated, although it is not significantly. But since its inception, it was recognized that BBJS has had difficulties related to the validity of participant data. And in 2018, registration was required to use NIK, which is National Identification Number. Problems still arise as a result of the incompatibility of data with the Director General of Population and civil registration data. This is through Presidential Regulation number 82 of 2018, Article 8, concerning integration of Kartu Indonesia Sehat and population data. Nevertheless, the trend of invalidation of this data is decreasing. So every year, the quality of data validity is improving. This is marked by the reduction in the number of invalid participant data. Every year, the gap percentage can be reduced. In 2020, the data validity gap is still 3.24. So as we see at the first the pandemic, everyone said, we stay here for you, please stay home for us. Even the Indonesians said that, also doctors, paramedics, everyone. But then after larger social restriction, which is like SBB or semi-lockdown, then the people becoming like, they go, the airport is open. This is in the airport. The first day of the airport is open. Everyone is queuing, it takes 3 hours to go. So there are many doctors passed away. So now it's Indonesia, terserah, mean Indonesia, up to you, whatever. So actually, what does the pandemic teaches us? The first thing, as Prof. John already told us also, is a self-discipline. We have to self-discipline our people. It's mainly about the culture. The world is changing, and Indonesia itself have to change to and adapt to this changing. So the people, we have to have a like self-discipline. There is like self-cleanliness itself, to wear masks all the time, wash your hands, and do physical distancing, and as well as work from home. We also like doing learn from home like this. We can do like webinar like this, and also tech savvy. It's amazing that even in the rural, in the district area, my student went for research there. When she wants to do an interview with them, then she said, "I'm sorry, I have to do a Zoom meeting," which is interesting. But also, we as Indonesian, it's the culture we have to emphasize for empathy. Empathy here meaning that we have to respect others, and if you don't want to get sick by wearing mask, and we don't want to make people sick because of us. And of course, we have to obey the government regulation. And there's a new form of heroism, which is not armed forces anymore, but is the doctors, paramedics, and there are many booming now business as well, which is food, because everyone is doing food delivery. I think that's all for me. I hope we all can get through this pandemic, and we hope that we're all safe and everything goes well. Thank you very much. Thank you, Mbak Krishna.
Thank you, Ibu Widya. Okay, ladies and gentlemen, we have like 2 speakers, and I already invite all the participants to write down the question. But before we read the question, I will try to stimulate the discussion with the first question about the readiness of the system. Prof. Murphy stating about the government policies, the functional and citizen compliance is important to make our system ready. And based on Prof. Murphy analysis from the comparative countries like Malaysia, Philippines, and Thailand, how we can create a readiness of our social security system. If I learned from your presentation that several countries have like cash transfer option, they also have like insurance scheme option, and for like Malaysia, they have like higher social security protection for the people, but for the other country, there is the variation. What do you think is the most important aspect to build during the pandemic to create the readiness for our social security system?
So this is to me?
Yeah,
yeah. I think the question of the informal sector is a really, really big challenge for Indonesia. Informal sector workers are about 60% of the labour force, and that's very difficult to deal with in public policy terms. I think Indonesia has made great progress in dealing with poverty over the past 20 years. Poverty has come down dramatically. It was very high at the beginning of the 21st century. It's now substantially less. That's been a great achievement. It's cost money, but one of the big contributions to bringing down poverty in that way was the cash transfer system, both unconditional cash transfers and then conditional cash transfers, the Family Hope program today. If I was thinking about what could Indonesia do that would make a big difference to the future, I would continue with cash transfers to families, to poor families, and I would develop a social pension for the poor elderly. Sometimes we think of a pension as not a contributory pension like the civil service pensions or the armed forces pensions, but a social pension for the poor, such as Thailand, for example, has developed. Sometimes we think of that as that will be a replacement to families caring for their elderly, but I think it's better to think of it as a way to enable families to care for their elderly by providing income support that makes it more possible for the elderly poor to live in dignity. So cash transfers to families and a social pension to the elderly would be my suggestions.
All right. We currently provide like PBI, the cash transfer, what's insurance fee for the health insurance for the poor. We already have it, but we also face the challenge about the universal health coverage of the health security. As Ibu Widya mentioned before, that we already the number of participants is increasing, but the universal health coverage is not achieved now. And the problem of the poor, especially for the pension, I agree with that. About how the government will do it, I think there will be many challenges, and also how we can reform the health governance is also become very crucial. I think it's related with what Ibu Widya mentioned about how we can provide the big data. So we can make a decision, is it to create a social security and deliver like the cash transfer to the people who are poor or who are informal and many others. So the big data is really important, like Ibu Widya says. So there is one question, Ibu Widya. It's related to the big data. The question is about what are the opportunities and challenges for big data implementation to Indonesian security system?
Thank you, Mbak Krishna. Yes, the opportunity to have a big data, we can do and make policy way easier, way better. Well, we can with the big data means this is one of example actually when in June or July, end of March, we have on March the president said that we have to do a large scale social restriction. So it's like semi lockdown. And actually, one of my friend from the professor from the public health faculty, he asked from the UNICEF about the Google Analytic data of all the Indonesian. This is the big data which the country we don't have it, so he has to ask to UNICEF, and it shows that how the people react to this large scale social restriction. It shows that in Jakarta itself, the people is very disciplined, staying at home, 85% stay home. And the rest of the Indonesian, it covers almost 85% of the population, which is was amazed as well. She can see that in some area, it's only 30 to 50% that they are stay home. Because at that time, we cannot go like from that, like you see a Mudik, we cannot go from between cities at that time. So we have to really stay home. So this is one of the big advantage. If we have a good big data, we can make implementation, we can make policy directly to the people that is needed, especially with the social assistance itself. The government just give some cash and also cash to the people, and even the later they just give several trillion for UMKM, for the middle small business enterprises to go up, like 12 million every, if I'm not mistaken, 12 million. So we can see who is needed, who and what is, who need the people itself. Because apparently I was also active and in reducing the stunting. So at that time we went to like a small district in Pandeglang. Some of them, they don't have even a membership of BPJS. They don't know, and they're very in the poverty. So we have to ask them to make a new one first so that we can screen their children. So this is one of the reasons why it's a big data is very important for us. So if by then we can track the people, like in everyone, like let's say we have like the IKTP, which is our ID card. It should be like we can track the people. It should be together with one card, like one social security ID that goes with ID and also tax and driving license. Everything is on one, so one data for everything. And we can see also with the phone and registered phone, well, but mostly we change phone number. So we can see the people going in and out, whether they're disciplined or not for this pandemic. So big data is really, really good. So we can see also with the patient from the data, we can say, oh, these are the people which have a comorbid. So it's difficult. They're the people who can lead to COVID-19. So instead of that, so we have to be very careful with these people, because what happened is people who with the COVID-19 rush in their children to the hospital in the emergency. The mother was crying, please help my daughter, please, please, please. So all the doctors came in and kept on asking, are you sure your child is not COVID-19, doesn't get COVID-19? No, 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 just please help. But every doctor, the nurses trying to help this kid. And then at the end, the doctor said, because there's like there is a puncture before, so it seems that this child already went to another doctor. So they asked, are you sure it's not? This is very important. And then the mother cried and said, yes, it was, the kid was diagnosed with COVID-19. Can you imagine? This is what I said. We don't have empathy. It's very egoist. You should, even though you know, you can just say honestly, saying that I have this, could you help me? Or things like that. This is something that is a culture. What I see is the new culture that we have. We used to be like that, but with this technology and everything, most people, they're very active in the internet right now. Even like this webinar, I can have a webinar with all the provinces in Indonesia. So it's very important. Thank you, Mbak Krishna.
Okay, thank you, Ibu Widya. So I got several points from Ibu Widya that the big data is important, but as we learned that we have like many data for driving license and then NIK and many others, and that's from different stakeholders. Probably the biggest challenge if we want to integrate the data is how we can like bridge between one stakeholder and the other. Okay, I will move to the question and answer section. There are already several questions. Okay, the third question is about what is the biggest challenge of Indonesian social security system to survive from this pandemic era? I think this question is for both speakers. Prof. Morfis, you can answer by like general overview from all the social security system, and Ibu Widya, probably you can give the argument from the health security side. What is the biggest challenge during this pandemic for our social security system? Please, Prof. Murphy.
Yeah, thank you. It's a difficult question.
Yes, indeed.
I think one particular challenge for Indonesia will be that the success the country has had in reducing poverty might start to go back and reverse that trend. And the safety net is not there to support those people. So if there's a substantial increase in poverty, that will put extra stress on the social security system. The social security system that Bu Widya was describing in terms of legislation and so on is both health insurance, BPJS Kesehatan, and workers and retirement saving insurance through BPJS Ketenagakerjaan. BPJS Ketenagakerjaan doesn't really deal with poverty itself. It deals with preparing for the future, very, very important, preparing for the future in terms of retirement savings and also some occupational benefits for people injured at work. But there's a fundamental challenge for that system to deal with the large number of informal sector workers. BPJS Kesehatan has jumped over that problem, I think, fairly successfully by the government simply enrolling people and saying the government will pay the premiums for health insurance for many people, a very large number of people, which is a really good initiative. Bu Widya will talk more about the health system and BPJS Kesehatan, but all of our health systems are being severely stressed by this pandemic. Indonesia's health system was, I think, just getting to a stage of getting the investment to build up capacity. So it will be a serious challenge to deal with a widespread pandemic with the existing Indonesian health system. Thank you.
Okay, thank you, Prof. Murphy. So it is a really challenging situation, not only for Indonesia, I think, but for the other countries as well. Moreover, for Indonesia, if we talk about the health security system, we already like for the poor, the government already transferred the insurance fee, but for the other social security, we don't have the schemes. Like for the pension for the poor, we still don't have it. We have like informal sectors pension, but by registering themselves and pay their insurance fee. Okay, Bu Vidya, probably you have any addition for the health security system, please.
Yes, for me, the biggest challenge is, as I said before, to revise the law. That is the most important thing, and we have a window of opportunity because President Jokowi already told us that I will do whatever needed to do that, even to make an amendment of the Perpu or make a government regulation, because even the law of Social Security itself, the first one, 2004, that one, even the government already realized that some are misleading. And as well as the law of BPJS itself, BPJS Kesehatan and Undang-Undang BPJS is also consists for BPJS Kesehatan and BPJS Tenaga Kerja. So that we have to reform, and we have to see it one by one. Actually, if the government wants, if the DPR wants, it's so easy. They can do it virtually. They can work doing it like this by to revise the law. That is the basic for Indonesia itself. Let's say maybe instead of 3 classes, we can make it into 1 classes, which is easier for all of us. It needs more study for that.
Okay, so what is the point of revision? So you said that we need to revise like the Undang-Undang Jaminan Sosial in 2004 and also Undang-Undang BPJS Kesehatan, Undang-Undang BPJS ya. So what is the main point for the revision?
Oh, there are lots of things.
There's a lot of things.
Yeah. Even there's a disharmony. It is the Undang-Undang SJSN is against the Constitution, our 1945 Constitution itself. So there we have changes on the Constitution, but Undang-Undang SJSN, it's against our Constitution. So definitely it has to be changed. And then Undang-Undang BPJS itself is based on the Undang-Undang SJSN. So as the Undang-Undang BPJS is, especially the Undang-Undang BPJS Kesehatan itself, as you can see, it's for health, self-security. But in that law, there's no, the role of the Ministry of Health is not there. So the BPJS Kesehatan go directly to the President through DJSN, the Dewan Jaminan, the Dewan Jaminan Sosial Nasional, the DJSN, is the boss of the BPJS itself. And so that's why it's always an argument between the DPR, the Ministry of Health, and the BPJS itself. As we can, do you still remember before the pandemic, the DPR House of Representative was angry to the Ministry of Health because we want to raise the premium. So after that, they, especially coincidentally, I met them. I met the head of the Committee 9 for the health and also the vice MPR. And I said, "You're wrong. You have no right to get angry to the Minister of Health itself, because by law, BPJS, he's nothing. There's no like control for the BPJS itself." And the BPJS guy said, "Yeah, I've done my best. I've done my job according to the law," which is true. So this is like a chaos. We need to revise that law.
Okay, I think if the question is what is the biggest challenge for the social security, we need to revise the law. But to revise the law, the biggest challenge is how we can like coordinate for each other, the stakeholder, that will be a long battle. As I remember, Undang-Undang BPJS, we need like years to discuss about this discussion, right, Bu Widya? So, okay, probably we need to move to next question. We have many questions. There is a question from Sinta Putri. I think she is the current student from our double degree program. Sinta Putri is our student from our double degree program, Master of Public Policy and Management. She asked about the national healthcare security system. The budget for our health security is already 48.8 trillion rupiah, twice compared to last year. The question is, how much is enough for the government to help its people in terms of national healthcare security system? Maybe by the presentation of people cover, or is there any different approach? Thank you. So that's the question from Sinta Putri. And we'll give the time for Prof. Murphy. How many percentage of people covered? So that will be enough for the government to distribute the budget.
Yeah. Healthcare costs a lot, no doubt about it. It has cost Indonesia quite a lot, though in the early years of BPJS Kesehatan, the budget voted by the parliament was not enough, but that was, you know, political and understandable. Because of the way that the BPJS Kesehatan works, you have a substantial minority of people who enroll themselves and pay contributions. And then for those who can't afford to pay contributions, the government is paying the contributions in order to enroll people and keep up their membership. That's where the cost is. That's one part of where the cost is. The substantial number of people who need that support and who can't otherwise, afford to pay premiums to be part of BPJS Kesehatan. How much will be enough? I don't know. But you would hopefully get to a point where the percentage is 100, where everybody is covered, because that's the point of having a national health insurance system. If you have substantially less than 100% covered, well, we know who the people are who are not going to be covered. They're going to be the people who most need it and can't afford it. So BPJS Kesehatan is a major initiative in Indonesia and a big aspiration, and I really wish it well. I really do hope that it works, but it necessarily will cost substantial amounts of funding to make it work.
Yes, thank you, Prof. So I agree with Prof. Murphy. We need like 100% coverage, so to make sure everyone can get the access to the health security. Ibu Widya, do you have any addition to answer the question about the coverage of the participants?
Yes, well, I agree with Prof. John Murphy, definitely should be 100%. And the challenge is how the government should pay that. That is one of the challenge which we have back again, revise the law. In there we can maybe say like the tax probably, as we all know that the NHS itself in UK, they go by from tax, which is ours with the government, and we wanted to have like cross contribution from the middle class or higher middle class people to go more, put more, but even though that it's impossible. So probably maybe government have to think of through tax, or they were say also from the tobacco tax or whatever. It's the government homework as well.
Okay, so the current system for the like health security system, the payment is from the insurance fee from the participants and also from the government transfer. And there is also one question. I think I will invite Mas Reza. Mas Reza.
Yeah. Please. So Yeah, so thank you, Krishna. So Professor John Murphy and Dr. Widya, it's really interesting to follow your presentations. I just wondering, Professor John Murphy, you said earlier that Indonesia, in comparison to Malaysia, Philippines, and Thailand, has the last developed social protection package. So in comparison to our neighbors. And on the other hand, there is a fact that Indonesia has the highest vulnerable group of informal sector. I just wondering what have been the main obstacles also for Indonesia to improve its social protection package. Actually, this question also relates to the previous question also asked by Mbak Sinta, that what exactly are the main obstacles? So why can Indonesia improve its social protection package as did by our neighbors? And then specifically, how about the potential? So what do you think about the potential of using community-based funding such as zakat to improve our social protection system amidst the pandemic in the short run? Do you think is this a perfect time to start engaging non-state actors and citizens in the short run? Or should we expect the government to perform better than now in the long run? So this is actually my question. So because, yeah, where should we start to improve these situations? I think this question also addressed also to Mbak Widya as well. Thank you.
So Reza, this is a very difficult questions. One thing that's worth remembering in all this is that Indonesia has the lowest tax base of most of the ASEAN countries, and certainly of the four that I've been looking at. So Indonesia raises less money through taxation than the Philippines or Thailand or Vietnam. And certainly Malaysia. So that's one area that has been, I think, a weakness for Indonesia, to not be generating the tax income that can then be used for social programs. Social programs have to be largely paid for by taxation. They're a form of redistribution from those who have to those who don't have. So repairing the tax base would be a substantial step forward. Why is Indonesia less developed than other countries is very much a political question, I think. The extent to which there have been political commitments in the past to dealing with these sorts of problems, and until the passage of the Social Security legislation, which passed the parliament, but then sat there with nothing being done about it. Until that passage, Indonesia had really only had a Social Security system for the civil servants, to some extent for formal sector workers, but that didn't really operate very well. So I think, although it might look bad that Indonesia is behind those other three countries that I was comparing to, Indonesia's made great strides, great steps forward since the years of SBY, in effect. And so I think there's a lot to be proud of. There are a great many challenges to come, but the BPJS Kesehatan is a major initiative, and if it can get through this crisis, and you know, with the repair of the law and with funding commitment, it can be a really major step forward. The other areas of income transfers, cash transfers, and pensions for the poor are, I think, still to be addressed. And in combination with the fact that Indonesia has a low tax revenue base is the other factor, that Indonesia is currently privileged, has the advantage at the moment of a demographic profile but that will come to an end in the next 10, 15 years when the numbers of elderly people will increase and the need to deal with some of these problems will increase. So there's a window of opportunity there, but it's not going to be open forever. So yeah, that doesn't solve the problem, Reza. I think your question's a very challenging one of where's the best place to start? What are the reasons for less development in the recent past than other countries? But one I think that needs to be addressed is the tax base, is the revenue base that government has.
Yes. Now the government only distribute a budget for the poor, but the rest is from the people who register for the health security. So we pay monthly from the like each employee, and also the private from the private sector, from the institution, not from the tax, the scheme for the financing. So Bu Widya probably have the additional statement about how we can manage the sustainable financing in our health security system. Do you have to invite like non-state? Yes, please.
Yeah, the collaboration, as I spoke before, so it should be good collaboration in shipping the money for the BPJS itself. But actually, we have to educate the people. Not the BPJS is not for curative to heal the people who is sick, but we have to enhance the people to do a promotive and prevention to make the people healthy living as well, and for so that they can have more money, more for them, they're healthy, and we also have to have like a food security itself. What we call it, ketahanan pangan. So if we can have like we plant our crop itself for the people itself. There's also in like a program from the in the village, disaster resilient village. It's like the village have to be resilient to some bencana, a disaster. So this is like they plant their food there, and even the security social assistance come also from the Dana Desa itself. So we have to make strong in the village itself, that the village like previous long time ago, we have like those that everyone have to have like a, we call it in Indonesia swasembada in everything. We have to do it all by ourselves, so we're not depend on import. That makes our economic growth as well. That's why the government, even though this pandemic, he's still engaging the people to do the UMKM to elevate that, and also there are lots of things he's still doing, like infrastructure. He built the trade road and like a toll road in Sumatra. It started already now. Still, this is part of the for 2045. Hopefully, we have our goal Indonesia Emas, which is this is still our program. But we have to do it from now, even though we're in COVID. We still have to build our country. Why we need that toll road? Because that brings the economy. That will make us strong. I think that's from me.
Okay, thank you, Bu Widya. If I will add like some case study, but the scope is only at the local government. There is also some initiative from the local government that provide like collaboration in funding. So they use zakat. There is Basnas and institution, but the scope is only locally, and I can find it in the other region. But if you talk about the local level initiative, there are already some collaborative funding in funding the health security. So the government at the local level try to collaborate with non-state to pay the insurance fee monthly for the specific people who are not covered by the central government. But for the national level, I agree with Prof. Murphy. We need to think about how we can allocate from the tax. But the next challenge probably how we can like increase the the citizen compliance to tax itself. That's also the other challenge. Okay, may I read one more question? This is the question. I think it's related with our last discussion. Do you think it is possible for Indonesia to build such a comprehensive social security system that link with tax system that could reach the informal workers as being used in developed countries? I think this question is suitable for Prof. Murphy, and for Ibu Widya, there is a question about the data system. How to recover a security system that has been damaged, that is hacking by data. So the security of data, how we can like maintain the security of the big data. That's the question for Ibu Widya. Please, Prof. Murphy, first about, is it possible to create a social security with tax-based system?
Yes, it is possible. Of course it's possible. Indonesia is a very innovative and dynamic country, and it's very possible. Part of the question is also that could reach the informal workers. So part of this issue is whether there are mechanisms and policies that can reduce the informal sector workforce by formalising it rather than putting them out of work, by regulating the informal sector. There's very little research that I know of about the informal sector in Indonesia, but some that I have read suggests that there are quite a lot of small to medium or small enterprises that, you know, might have 5, 6 workers and that prefer to remain informal. They don't want to be in the formal sector because in the formal sector there's regulation and there's taxation. So this is a challenge, but I think one strategy would be to think about ways in which informal sector workers and employers can be moved into the formal sector. Definitely, it's quite possible for Indonesia to develop a comprehensive social security system linked with the tax system. It's eminently within Indonesia's capacity. It's a question of political will. It's a question of citizens' engagement to say that these are important questions and should be part of the politics. But both reforming the tax base and taking measures to reduce the informal sector workforce would be both steps towards doing that. Even without changing that 60% of the labour force that are informal, even without changing that, there are ways in which those people can be reached, and a social pension is one obvious way in which that can be done, because that, you know, it doesn't matter what people have, what sort of work people have had, if they qualify on the basis of having a low income, then they qualify. And as I said earlier, that's not just about supporting elderly people in poverty, it's also supporting their families who are otherwise, you know, who are going to be helped to support their elderly people.
Okay, thank you, Prof. Murphy. I will give the next time for the Bu Widya. There is a question about data security, how we can maintain data security if we have our established big data.
Yes, again, we have to have a regulation. Like the internet service provider in Indonesia is still like free. Everyone have that one, and that is why most of the hackers all over the world, they are from Indonesia, because they cannot trace that. It's so open. And as we know, you know, also maybe when you're in China, you cannot open Yahoo or Google. You cannot do that. There's a restriction, because that's why then they can manage to have like the 5G technology, because it's they really look, they can see what you're doing and what you're doing, because it's all monitored by the government. So you have to be controlled by the government.
So the government need to maintain the data security itself.
Yes.
Okay, thank you, Prof. Murphy, also Ibu Vidya. This is a fruitful discussion. There are many questions, and also I think if we want to longer discussion, we still have many question and answer session. But we already reached our timeline is now 11:23, so we have like 7 more minutes to end this session. I will give each speaker like minutes to give a closing statement. Please, our Prof. Murphy first, and then Ibu Vidya for the closing statement.
Well, thank you for inviting me to take part in this webinar, and thank you for the questions from people in the audience. And these are big challenges we're all facing, and as we just said, let's hope we all get through it to the other side, and then can after the crisis can turn back to the creative work of developing better support systems for our people.
Okay, thank you, Prof. Murphy. So please, your closing statement, Ibu Vidya.
Thank you for the chance just for me to participate in this webinar. For me, my closing statement is we can do this together. We can do this together. We can go through this pandemic together, and we can be hand in hand together for the good Indonesia 2045, 100 years of Indonesia. We can be one of the big countries, hopefully. Thank you.
Thank you, Ibu Vidya. Ladies and gentlemen, already joined with us in this session, Professor Dr. Eko Prasojo, our Dean of Faculty of Administrative Science, Universitas Indonesia. Please, Prof. Eko, give the closing statement for our today's webinar. Prof. Eko, are you with us? I think there is a problem with the connection.
Hello. Yeah.
Yes.
Hello,
yes.
sorry. Good morning, Indonesia, and good morning, good afternoon, Melbourne. Pak John, how are you?
Good. Thank you, Pak Eko.
Oh, thank you very much, Pak John, for joining and giving us very important information about the social security and also COVID-19, yeah, in the era COVID-19. And thank you also to the Mbak Widya for joining us. I would like to close with a statement that a German Nobel philosopher, Johann Wolfgang von Goethe, once said, every day we should hear at least one little song, read one good poem, see one fine painting, and if possible, speak a few sensible words. So if we have not done all of them yet today, but at least through this webinar, we did speak new sensible words to end this productive week. Thanks, Pak John, and also Mbak Widya for sharing your thoughts and wisdom with us today. And also thank you, Mbak Krishna, and all participants for joining us in this webinar. And I would like to say have a nice weekend to all, and see you again next time. Please join our group photo together to wrap up this wonderful day. Thank you very much again, and see you in the next webinar. Thank you, Pak John. Thank you, Mbak Widya, and Mbak Krishna.
Thank you, Prof. Eko. Terima kasih. Okay, ladies and gentlemen, all speakers and so participants, that's the end of our discussion today. So we have discussed about not only the historical, about our social security, the comparative policy from each countries, Indonesia and the other countries, but also we discussed about what things to do for the next in our social security system. The next session is taking picture together. So for all the speakers, please turn on the video, the Pak Roy, Mas Reza, Scott. Siva, thank you, and also Mas Wahyu. Yeah, please take the, let's count to 1, 2, 3. I will take the picture. 1, 2, 3. Okay, thank you everyone. For all the participants, the committee will deliver the feedback link. You can fill the feedback links, and the committee will send to this presentation and also the certificate.
Okay.
Okay, I will give it. Thank you for all the. This is the link, so everyone can claim your certificate and also fill the feedback on the bit.ly/feedback 24/07/2020 and fill it the feedback, and then the committee will give the certificate for each of you. Thank you very much for today's participation, for all the speakers and also for the participant from both from Zoom on and also the YouTube, and see you in our next discussion. Thank you very much. Good morning.
Thank you. Thank you,
Okay,
Mbak
thank you
Krisna.
very much.
Thank you,
Terima
Pak John.
kasih.
Thank you,
Widya.
Pak John, Mbak Widya.
John, thank you.
Thank
Mas
you.
Scott,
Thank you.
Scott Brenton, how are you? Thank you, ya.
thank
Thank you very
you.
much.
Pak John still work from home? Okay, bye.
Pak Jun.
Bye. Thank you, Pak Roy.
Yeah.
See you.
Thank you. Thank you.
Bye.
Okay, bye-bye. Thank
Bye.
you.
Thank you.